Everyone seems to know that facial fillers are wonderful to improve wrinkles, and many people know that they can also be used to improve volume loss, which occurs with aging in the face. But some of you may not know that there's some less commonly used areas for fillers too, where they're still very effective. One of these is in the temple area here. Some patients getting older get a depression or a hollowing in that area. And we can place the filler in here to augment the temple region and make it look much more youthful. We also tend to lose bone as we get older, not just have saggy skin. And one of the areas we can lose bone is here in the brow margin. And by placing some filler in this region, we can plump up the lateral eyebrow and make it look a little bit lifted. We also tend to lose bone in the area just underneath the nose here, what we call the piriform fossa. And so in addition to using filler to improve the furrows here, by placing some filler a little deeper in this area, we can actually support the base of the nose and take away that collapsed look that occurs with the aging process. In a similar vein, many of you will note that as people get older, that they can get quite a deep depression in what we call the mental crease. Mental just means the chin. And so by placing some deep volume filler in this area, it actually improves that crease, and just as importantly, it supports the lower lip to give a rejuvenated look. Furthermore, we'll sometimes use fillers in areas such as an acne scar. What we do is check and see just how much scarring is under the acne scar, or indeed any other type of scar as well, and we can inject and elevate that scar a little bit to improve the contour. And finally, one area where we use fillers a little bit less commonly is in the nose. This is particularly true if someone might have had a previous rhinoplasty, but they have a little depression here or there. We can put a little bit of filler in to augment that area. This may be done as a temporizing feature until we go back and do a little touch-up on the nose, or in some patients who may not wish to have another rhinoplasty, we can put a little bit of filler in and repeat that when required. So you can see that facial fillers have many uses, some of them quite common, but these are some of the less common uses that you may be interested in exploring.